So good afternoon. This is Dennis Scanlon from Penn State University, and we're here today to record another episode of Ask the Experts. I'm pleased today to have as my guest Dr. Anthony Agostini, who is the partner in the Cardiology Center of Amarillo and chair of the Department of Medicine at Baptist St. Anthony Hospital in Amarillo, Texas as well. Tony is a Penn State graduated in 1992 from the Department of Health Policy Administration, currently practicing medicine in Texas. But has a lot of Pennsylvania roots. Not only has lived in Pennsylvania, but did his medical degree at Lake Erie College of Osteopathic Medicine and a residency and fellowship at West Penn Allegheny Health System. Great. So Tony, thanks for joining us. And what I really wanted to do today, and this is a little bit different than we've done in the series, I wanted to talk to a practicing physician and really get, in this case, your take on the healthcare landscape and how it impacts those on the ground who are seeing patients, treating patients, obviously, in your case, in cardiology. Maybe what I'll start out with is the question of, it's been pretty impossible for anybody to ignore the health reform debate, right? Not only sort of the Affordable Care Act or Obamacare, but the attempt to sort of take that back as well. Right. And that's been covered in the news significantly throughout this year of 2017. I guess what I'd like to know, for starters, is your perspective, maybe the perspective of those that you interact with in the practice of medicine on this topic.
Right. Well, my own personal experience with the Affordable Care Act, at least as far as we're in the trenches seeing patients, is pretty minimal. But from a philosophical standpoint, I think that the Affordable Care Act and the intent behind it was something that America really needed, which was better access to insurance. And a lot of problems that we see on a day-to-day basis is people can't maintain their insurance if they change jobs. Of course, their portability of insurance is dismal. The fact that if they have a pre-existing condition, if they try to get another insurance plan after leaving a job, their premium skyrockets. And even in the people with a steady job and steady insurance year to year, when we renew, myself included, when we renew our practice's insurance for us and our employees, every year it seems like our deductible goes up a couple more $1,000s. So, what is insurance and what does it really do for you is really limited by, the private insurance market, government regulation of insurance, lack of insurance competition. That being said, the ACA was a very cumbersome act, and did it make a lot of real change? I'm not quite sure. The thing that is troublesome is that even though people do get insurance, the deductibles are so high that their out-of-pocket expense for even routine care or incidental care that comes up with acute illness or injury is still prohibitive. So I still think that although the intent of the bill was a noble one, it really didn't have the teeth to change things. And I think that sometime in the future that needs to be addressed.
And obviously in this past year with the new administration, there have been attempts to sort of repeal and replace has been the language that has been used. I guess, yourself or among your professional society's colleagues, given that it's not perfect, as you just mentioned, maybe the goals were sort of noble, but the final product had some limitations. Anything in particular that you think would help in terms of change, whether that's getting rid of or replacing with specific provisions?
Yeah, I'm by no means not an insurance expert, but the lack of competition in insurance markets and the way that things are set up right now, where you have almost like miniature monopolies and regional monopolies, where you can't get another insurance plan to come in and compete to make another insurance company offer a product that has either a lower deductible or a lower premium without dropping off several benefits. So that's the thing that I think would change things the most. I know that a lot of that has to do, and the lack of that impetus has to do with strong insurance lobbies, and that's kind of our American political system. Unless another lobby came along to outspend them, I can't see that changing anytime soon.